welcome. I'm Dr. Meghan. This is office hours. Ask me anything about weight medicine, all the things. If you ask me a personal medical question, I'm going to change it so it's more broadly applicable. But other than that, fair game. Let's see. Okay, we're going to get started. If you're new to this, welcome. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this channel is the place to go if you are confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions. So, welcome. Today we are going to talk about, we've got a bunch of great questions. All right. First question is, I see you writing on the screen that this is a lifelong medication. Okay, this is in regards to Wegovy and Ozempic about skipping doses. I see you put that this is a lifelong medication. I thought that at this time it's only recommended for 1 year max. I'm concerned I'll gain weight back if I give this a try and it's only prescribed for 1 year. Do insurance companies cover it for a lifetime? This is an excellent question, and you are absolutely right. If you stop taking this, you will likely gain the weight back. We have good data to show that when people stop these medications, the weight comes back on. Now, does this mean the weight comes back on for absolutely every single person? No. Are we probably going to be at a place where we have more of a maintenance protocol like 5 years from now? Yes. Do I know if insurance companies will cover it forever? No. Unfortunately not. I mean, right now, the current standard expectation is that they do cover it if people are showing improvement. So let's say your insurance company approved it and then you only lost like 4% weight, total body weight, and you were on something like Wegovy where we would be expecting you to lose closer to 10 to 15% body weight. Then they might not cover it for lifelong. But usually in my experience, when I get this approved for patients, insurance companies will continue to approve it. That still means that you have to redo the prior authorization every so often. And this is a very significant financial burden on insurance companies. If you think about the amount of people and I'm just talking about the US, if you think about the amount of people in the US that are candidates who are going to benefit from this medication and the cost that anybody has to pay, whether it's out of pocket, whether it's the insurance companies, that is a very significant financial commitment. So of course they are incentivized to not cover it if there's any reason that they don't need to. So who knows what that will look like in the next couple years. I tell patients, like, just these medications are amazing, but also get ready for kind of like a rocky experience, because this is not like sending your statin medication to the pharmacy. These are medications that are very tightly regulated in terms of who will pay for them. So if you want to get it tomorrow and it's in stock, the quickest way is always out of pocket. Most people really don't want to do that. That's kind of what insurance is for. So the short answer to that is it's definitely recommended for lifelong right now. That is the current accepted practice. So if you're on it, it's working for you. You're, in general, if it's working for a patient, their doctor is going to want them to be on it for lifelong. If that person goes off of it, they will most likely gain the weight back. Right now, in general, insurance companies are approving it, but you do have to kind of re-up every year the prior authorization. So that is an area of active development. All great questions. All right, next question is for Retatrutide. How much is it? That is a great question too. Currently, Retatrutide is not available. I'll leave the link below with regards to the video that this is about, but it's currently not available. It's still very much in the testing phase. It has not been FDA approved at the time of this filming, so stay tuned for that one. I will definitely let you guys know when I hear anything. Let's see. Okay. This one is a little personal, so I'm going to change it. Can you, as a side effect, have dry blood inside the belly button with the injectable medications, Wegovy, Zepbound, Saxenda? I have not seen or heard of that. You do want to be careful. Anybody who's on these medications, you have to be careful of where you are injecting the medication. Don't inject it in your belly button. That is not the place to inject it. Don't inject it in your belly button. Talk to your physician about the safe places to inject it. A lot of these companies also have videos on their website that kind of walk patients through where to inject it. Do not inject it in your belly button. Most people do inject it in their abdomen because you have to get the subcutaneous tissue. You definitely don't want to be injecting it into the muscle. So a lot of times when people are doing the subcutaneous injection, it's just a lot easier to get the tissue that's around the abdomen, but you have to be careful of where that is. So, the answer to that is no. I have not heard of that, but if anybody else has, let me know. Be very curious. And we can all learn something. But I'm assuming that you're not injecting it. I'm assuming that the person who's asking this question is not injecting it into their belly button, but they're wondering if that is a side effect that anybody has heard about. And I have not. Okay. Next question. Now in my 3rd month of Rybelsus. Okay. I have lost 20 pounds, but have hit a plateau. I want to lose an additional 6 pounds. Currently at 191, my goal is 185. Taking it with metformin, A1C dropped from 9.4 to 6.4, which is still pre-diabetic, but I want to try Ozempic next. Worry about the cost on Medicare Part D. However, it might be thousands of dollars. Well, first of all, congratulations, because, usually if people on Rybelsus it's only approved for type 2 diabetes, and it is not approved for weight loss, and that's also because it really, at the dose that Rybelsus is available at, really doesn't seem to help with weight loss. Now, I made a separate video where there have been studies where they tested, side note, Rybelsus is oral semaglutide. So there is an oral form of Wegovy and Ozempic that is only approved for type 2 diabetes, and it really isn't to treat weight loss. I've seen this clinically. It's not great at what we have currently available as a weight loss tool. I think we have sound again. If I'm seeing them in a weight consult and they're on Rybelsus, I'm really not expecting them to be losing a lot of weight. So if you have, congratulations. That's a nice benefit if that is the effect you are going for. In terms of Ozempic, so if you're going to change from Rybelsus to Ozempic, somebody who's changing from the oral to the injectable likely would lose more weight because the injectable is approved for weight loss, and we do see that quite effectively. Medicare's difficult, but for patients who have diabetes, I've definitely had them approve the weight loss. I've definitely had them approve Ozempic or Mounjaro for diabetes. So it's much harder to get Zepbound. It's impossible, actually. I think not impossible. Nothing's impossible, but it's very difficult to get Zepbound approved for weight through Medicare. Wegovy is a little bit easier now. There is that new FDA regulation for obesity or overweight with reduction of cardiovascular risk. So sometimes they will cover that. But if somebody has diabetes, it is a lot easier to get Ozempic approved. I can't speak to everybody's insurance. I can't speak to everybody's plan, but in general, that's what I've seen. So good luck and thank you for sharing. And congrats on the weight loss on Rybelsus. That is unusual, but hey, we'll take it. So that's going to do it for today. Thank you so much for watching. If you have questions after this, please leave them below. If you want to work with me directly, I'll leave the information for that down below. I'll leave all the videos that I talked about down below, and please be well.